Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Emere specialist today by calling 855-433-5633 or visiting Emere.com. Learn how you can get the relief necessary to start living your life again.
Welcome back. We have Miriam Rahimi here today, and she is with Emere Healthcare. Welcome.
Thank you. Thank you for having me.
Nice to have you here today. Tell us a little bit about Emere Healthcare and what you do there, and who benefits from this. I know you do treatments for the knees, but you do it for all joints as well, don't you?
Yes, absolutely. So at Emere, we're dedicated to providing individualized personal health care for patients who are suffering from any muscle or joint injuries. And we give regenerative, non-surgical treatments for any type of musculoskeletal disease or disorders. And we help, or we try to prevent and, in many cases, prolong surgery. And we partner with the patients through education and lifestyle modifications so that they can meet their needs, reach their goals, and give them the freedom to do the activities they love and enjoy.
Okay. What type of services do you provide that are non-surgical? Are there different levels that you do depending on the injury or the joint pain?
Yes, absolutely. So at Emere, our physicians, I'm a physician there as well, we have other practitioners. We do joint fluid therapy or viscosupplementation injections. And what that is that we provide hyaluronic acid injections into the joint under image guidance. Right there you see the ultrasound machine, and we provide the injection under the image guidance. And so the accuracy of the medication is guaranteed. We place the medicine where it needs to go, and we get wonderful, favorable results. This treatment is FDA approved. It's covered by most major insurance plans, and it acts as a lubricant for the joint, in particular for the knees. And so, now when patients have arthritis, the bones are grinding on each other.
Sure.
And so when we inject this hyaluronic acid and we use a very highly purified form, the bones are no longer grinding, but rather they glide gently and they help alleviate pain. 86% of our patients get improvement, significant improvement with this treatment modality. And at Emere, we're very dedicated to measuring our outcomes, and we're very results driven. And with the state-of-the-art technology and doing these injections under image guidance, we can achieve those results.
Are these major joints that you do? You mentioned arthritis, for example. A lot of times people might have arthritis in their hands, in their joints in their hands. Is that something you would do, or it's mainly elbows and knees, shoulders, the major joints?
The joint fluid therapy is primarily for the knee joints. It's FDA approved for the knee. It can be given in other joints, but we at our centers give it for the knee. In addition to the viscosupplementation injections, we provide PRP. What that is platelet-rich plasma. And that can be injected into any of the joints of the body.
Okay.
And if you're a candidate, it can be given to anyone from either the elderly to the elite athlete. And if you're a candidate for PRP, you come into the office, we take your blood and we spin down the platelets. And the platelets have a lot of healing factors, a lot of regenerative factors, a lot of growth factors. And we flood the tissue, either the tendon of the elbow or the knee, or even in other osteoarthritic conditions. And patients get wonderful results with that as well.
So you mentioned regenerative. That means that you can help the tendons or things like that just grow a little bit better, or is something, in other words, something's been torn, something needs repair. These injections can actually help them regenerate and heal quicker.
Absolutely. We also have introduced stem cell injections into our practice, and under strict criteria and given to the right candidates, stem cell injections have been proven to alleviate pain and improve function, and that they also have regenerative properties.
Okay, what are the steps? Somebody comes there. Do they need, first of all, to check with their health care plan? Is this covered, or primary physician can send them there?
a primary physician can send them there, or you can come directly. You can look online at emere.com.
Okay.
You can get our number online, and you can book a consultation with one of our practitioners, either with myself or one of our nurse practitioners or other physicians available. And then you come in to see one of us, and at Emere, we're dedicated. We treat each individual as unique. We understand that everyone is different, and so when you come in to see us, we get the accurate diagnosis, because not all knee pain is necessarily osteoarthritic. It can come from the meniscus damage, it can come from tendon problems, from ligament issues, and so we hone in on getting the accurate diagnosis.
Okay.
After which we have an arsenal of regenerative treatments that we can provide for the patients to help them feel better. And let's say if they failed all these conservative measures, we're very well connected with orthopedic surgeons in the area, and we therefore help with continuity of care.
Okay.
Where there's no breach in your care. In fact, we can get you right away to see a surgeon if needed, and you can have the replacement surgery if necessary, if our conservative measures haven't worked for you.
How long do these treatments generally last?
Well, the viscosupplementation injections can last anywhere between 6 months to 24 months. The PRP can last anywhere between 6 months to 2 years.
Oh, so quite a long time.
Yes, especially the viscosupplementation injections. I've done it on one of our chiropractors in our office, and she's had it for the last 2 years and hasn't really required a repeat series. But
wow.
It is something that insurance covers and can be repeated every 6 months under the major insurance plans, the viscosupplementation
When
injections.
someone comes in for a treatment, is it a series of treatments over a few weeks?
So it depends on what treatment we give you.
Okay.
If we're doing the hyaluronic acid injection, that requires a 3 to 5 week series of injections. They're given a week apart. You get the most benefit actually after the 3rd shot, but the results can last anywhere between 5 to 6 weeks after the injection, after your last injection. But it's given in a series, and we see really wonderful results when given in that way.
And would the patient, after the first injection, let's say, already start to feel a little bit better? In other words, a little bit of that pain, the joints working a little bit better after just the first time, or it might take a few?
That's a really good question. So the viscosupplementation injections, the joint fluid therapy, is not like a cortisone injection where you have immediate relief right away. It takes a little bit of time and a little bit of patience. However, patients do receive some benefit after the first injection, but the most benefit is seen usually after the 3rd injection.
Okay. Along with this, I see you bending the knee here.
Yeah.
They come in and they have the series of injections. Are there specific limitations while they're having these injections to them? In other words, exercise, don't do certain things, or on the other hand, are there certain different types of therapy that they can do at home, whether it's walking or just simple exercise?
So we combine the injections with a customized and tailored rehabilitation program. So they have physical therapy along with the injections. Sometimes we do bracing. The day of the injection, because we use the image guidance, we really limit the pain that the patient experiences. It's very gentle. The practitioner is not fishing around in there. My hands, I always say, are very small, so it's a very gentle injection that the patients are receiving. And so they can go back and do their regular activities. They can go right back to work. There's really no downtime associated with the injection if all things go well, and there's no allergic reaction or anything that we don't really expect.
Very good. And if someone wants to get a hold of you, we have the number is 949-610-1040, and you're very close by, aren't you? Right over here at Laguna Hills, near the Laguna Hills Mall, right?
Right near the Laguna Hills Mall. We have 4 locations actually. We have a location in Newport, in Torrance, and in Northern California in Fremont.
Oh, okay.
Yeah.
Very good. Well, this really looks like an excellent benefit, and the way you said that if during the treatments you find that surgery may be needed, you're well connected into that. So
absolutely,
it's not as though you're just sort of isolating them into what you can do. You're there for their health, their best benefit, and this sounds like a very good procedure, non-invasive, and covered by insurance. Really good. So people, if they're having some kind of joint pain, they can come to you, get a consultation, and then from there you can get things going with their maybe their primary care and their insurance.
Absolutely. At that point,
Very
when
good.
they come to see us, we can manage their care and we can triage their care to, if they need surgery or whatnot. But we're hoping to prevent
Yeah,
we're
yeah.
hoping to prolong and prevent surgery and then allow the patients to feel confident that they've exhausted all conservative measures before taking the next step.
Yeah, that's great, really. If you can prolong surgery or maybe even eliminate it altogether, I think that's
Yeah.
wonderful. Well, thank you for coming on. I
was
think
my
this is
pleasure. Thank you.
a great service that you provide, and you can call Emere Healthcare, again, 949-610-1040. They're located in Laguna Hills, close by. Doctor, thank you very much. It was nice having you on.
Thank you again. We had a great time.
All right. Folks, we'll be right back with Marsha Wilson, Social Services Corner.
Are you one of the millions of Americans suffering from painful joints? If so, relief doesn't have to mean surgery. We offer non-surgical and regenerative treatments tailored for your body to resolve pain and restore mobility. Make an appointment with an Emere specialist today by calling 855-433-5633 or visiting Emere.com. Learn how you can get the relief necessary to start living your life again.